Okay,
Awesome.
good morning. I am going to be giving you a little bit of information about some of the people who were part of this study because the rest of the people who are part of this presentation are in California time, except for Tiffany, of course, who graciously joined us bright and early. But they're going to be coming on a little later. So we're going to start in Pennsylvania, and then we're going to talk about the COVID study that happened in California as well. So I am actually the principal investigator for both statewide projects. Tiffany Grimes is part of our California study. David Hudsonman is also part of our California study. Christina Graham Savage is part of the Pennsylvania study. Sabrina Tate is also part of the Pennsylvania study. This was the first statewide, Pennsylvania was the first statewide COVID LGBT specific survey to look at hesitancy of taking the vaccine, and then some of the demographic information about who was getting it, where was getting it. Pennsylvania is a very diverse state. We have Pittsburgh, we have Philadelphia, Erie, and Scranton are the major four cities, and they're all in the corners. And in the middle is the T. We call it Pennsyltucky because it has a challenging demographic to get to. It's not uncommon as you're coming across the Pennsylvania Turnpike to see huge signs that are usually very conservative, very Bible thumping, and having a lot of education to do in those areas. They're not at all LGBT friendly areas. And so as the lead with Dr. Tamara Moss, she's not able to join us today, but we firmly believe that the best research comes from community university partnerships, right? I've been a frontline activist for a long time, and frontline activists often come into that work without having any training, without having any courses, without having any knowledge about how to evaluate and test whether or not their good ideas are going to work, right? And researchers often go into looking at products or projects without having an idea of how people on the grassroots actually reach out to communities to get real representation, to get understanding of what demographic, especially in hard to reach demographics, like the LGBTQ community. And so assembling partnerships between universities and existing community centers, looking for key informants, looking for key stakeholders, using personal networks, having a web of people that you can tap into is crucial. And so what I'd like to do is have Christina talk about what Bradbury Sullivan and Adrian Shanker, who was also part of our Pennsylvania study, who hasn't yet been able to come to this meeting. But Christina is our data person and was able to step into Adrian's shoes for this presentation. And that's one of the other good things about this, right? When you have a team of people, you can play tag. Hey, I can't do this. Can you do that? Can you pick up that presentation? Hey, we're going here to this presentation. It's a good way of making sure that not only are you providing a good product, and good data, but you're also lessening the stress on individual players, and you're able to actually support junior faculty who need, publications, people who are new researchers who are just sort of getting their feet wet in the game, folks that usually don't get a voice at the table, the grassroots folks, right, who don't get published, who don't understand what that is all about, who don't often have the means to go into an academic setting and feel like they're an equal and feel like they have valuable knowledge that is necessary. Um, so Christina, would you be willing to talk a little bit about the survey itself and how we did the data collection and maybe a brief overview of the data?
Sure, I'd be happy to. I think the best place to start is probably what drove us to even begin this project. Certainly, we were, as a really involved community center, we were already thinking about the ways that the state, as well as our local area, could be enhancing data collection. So Bradbury Sullivan LGBT Community Center is located in Allentown, Pennsylvania, part of the Greater Lehigh Valley. So very close to New Jersey, not too far from Philly, an area with multiple colleges, which I think makes it kind of a unique place to be as far as when you look at the landscape of Pennsylvania. But one of the other centers that we partner with on some other projects out Boulder County had done a short survey to look at hesitancy within their community. And when we saw their report, we said, hey, we could do something like this. We have staff that's trained in research methods. So I consider myself first and foremost a researcher. I actually earned my MPH at GW's online MPH program. And so survey research has been a large tenet of my work. And we've had the great fortune to have already worked on a large survey in Pennsylvania. One of the projects that supports a lot of the work that we do is Pennsylvania's LGBTQ health needs assessment. It's administered every 2 years. So we were just coming off of 2020 and are starting to plan for 2022. And we use the basis of many elements of that to be able to inform what we did, including our partner network. I really think if you were to look at a map of our respondents, and as well as a map of where our partners are and the major universities in Pennsylvania, and you would see that those are where we were able to get respondents from. There were certainly areas that we weren't able to reach, what Kat so fondly called Pennsyltucky. But we were really able to rely on what we knew from the health needs assessment, what out Boulder County had already attempted to do, as well as being able to partner with two really experienced academic researchers, Kat and Dr. Tam Moss. And that was what informed the basis of this work. It is an IRB approved study, so it went through IRB at Bryn Mawr, which we were really grateful for. We felt like internally, yeah, we could do a survey and we could send it out to our local community and we could get data that would maybe inform our programs, but that would be as far as that information went. It wouldn't be something that we could turn into conference presentations, or even we presented the report to the State Department of Health and they included it in their COVID resources that they've made available. We really felt like we had to go through an approved and systematic way of doing this. And we moved fast. I think we probably started the IRB process in what, early February, and we were rolling out the survey by the first week of March. So a little bit different than my previous experience. I've been a researcher at Penn State and I've never seen an IRB move quite that fast, but I think they were very understanding of that there wasn't a lot of time. If we were to wait, the information was going to change and we weren't going to be able to capture those initial impressions. So that core team of the four of us, two people at our academic institution and two people sitting at the community center itself, were able to formulate our survey. We got it approved, got it out. Were there changes that we would make looking back? Oh, definitely. But I think we were all really happy with what we were able to start with. And we really relied on that partner network that we've built both from the health needs assessment, the personal networks of Dr. Carrick and of Adrian Shanker, our executive director here, to be able to put the survey out. There was no paid promotion. It was mostly distributed through social media. It was an online only survey on Qualitrix, and we collected data for 4 weeks. And we're able to get about 1,500 respondents, which I considered incredible. For comparison, our health needs assessment gets about 6,500. But it was 10 weeks in 2020. It has paid promotion and it's supported by funds from the Department of Health, whereas this was very much a community-based effort. And I'd love to talk about the data. I'd love it if people have specific questions. You have access to the report. If anyone's not able to see that file or download it, please let us know and we'll add it back into the chat. But we found out some really interesting things right off the bat. Many people were getting vaccinated, at least as soon as it was available to them. This was before Pennsylvania had opened up vaccines for everyone. That happened about 2 weeks after the survey closed on April 19th, if I remember correctly. So there were still people for whom the vaccine was not available. But that most people, if they had not gotten the vaccine, they were willing to get it as soon as it was available to them. And that was great. We were really excited to hear that, but we knew from the work that Out Boulder County had done, from what we were hearing anecdotally here at our center and at other centers in Pennsylvania, that there were people that were hesitant, that they needed more information, and that they had some concerns. And by collecting this information, we were able to address things, at least here in our local community. We held multiple vaccine clinics here at the center. We used people's feedback from the survey to inform the kind of messaging that we put out then and that we're still using as time goes on. And we were able to use our structure to help inform other projects, which you're going to hear more about later. But overall, I think it was a really successful effort, and I'm impressed with how quickly and how devoted everyone was able to jump onto the project, get it out there, and get some information. I really consider us to be a data-informed and data-driven community center in a way that not everyone has the capacity to do. Certainly most LGBTQ community centers do not have full-time researchers on staff. And we recognize the uniqueness of that situation, but it allowed us to help a little bit. But I think it would be really great to hear from some of the other projects.
Mm-hmm. And that really is perfect, because I want to segue off of your community-based efforts. What we realized is, for me, we were really excited when the survey data started coming in, and we were looking at it almost every day for a while. But we realized we were missing a lot of people in Philly. And so that's why our network in the program is so important. I reached out to Sabrina, and I want to turn the mic over to Sabrina Tate to talk about her efforts at Babashi and really, what they were doing to respond on the ground to the COVID pandemic, and also to help assist getting people to understand why they needed to take a survey in the middle of a pandemic.
So, hi everybody. I'm Sabrina Tate. I am officially, after a very long time, and actually in the process of being in GW's program, the official executive director of Babashi. So that in and of itself was a whole ordeal, right? But when Kat asked if we would have folks participate in the survey, I thought, of course we would, right? Babashi used to stand for Blacks Educating Blacks About Sexual Health Issues. It no longer stands for that because we do much, much more than that, but is the premise for which our organization was built. We were built out of the HIV/AIDS epidemic, so we're familiar with having something that is communicable, impact the Black and Brown community, and people having reservations about how to treat, how to talk about, and how to engage people, like just the general public. So when we were asked to be a part of the survey, we got what we always get. What do we get? We are giving you information. What do we get as a result of giving you our feedback? And I let them know you get the satisfaction of having your voice heard. What we know from the Black and Brown community is there are reservations with getting any vaccinations. The history that we have, you can obviously read up on the Tuskegee experiment, along with several others, right? One of the books that we read as a part of the program was Black on Both Sides, the transgender experience. And what we know is that Black folks have been used to experiment on and to do all kinds of health outcome research without really having any repercussions for things that were done unethically. And so much of the reservation was not around being a member of the LGBTQ community, but being a part of the Black and Brown community. What we got as a part of the survey were people talking about, how do we know where the vaccination is coming from? How do we know we're getting what is pure vaccination and not something else? But their reservations were kind of assuaged by the relationship they have with our organization and trusting us, watching us be a part of the rollout of the vaccination. I mean, obviously, I'm not going to ask you to take something that I'm not willing to take myself. I was being vaccinated at the very same time. But it was good to have them be a part of this, and it extended into a conversation that was much larger. So the impact of this, I have to thank you guys for doing this, because we wound up having a community. We had what was called the community conversation on LGBTQ access to healthcare. And we got around not just this vaccination, but vaccinations in general and things that are happening in the Philadelphia community around healthcare, and how we get folks who identify as a part of the LGBTQ community into our community center to get healthcare and have them get information so they're more comfortable with making the decision. We also said this, answering the questions around this doesn't mean that we expect you to be vaccinated or we're pushing you to be vaccinated. We really want feedback so that we know how to inform you better and give you up-to-date information about what's happening. So that catapulted us into how do we get to young folks, because we found that they had more reservations, believe it or not, without that history of the Tuskegee. They don't know a whole lot about the history. They just know we don't trust medical professionals. Well, why is that? We launched what's called B+, which is a social media platform for Black and Brown LGBTQ youth to receive information about their healthcare. And we talk about things like blue balls, like that's not an actual medical thing. You know what I mean? We talk about the vaccination and COVID and being comfortable with individuals 12 and over getting vaccinated. So we were really, really grateful for the opportunity to be a part of the survey, because it really many other questions to be answered around what is the vaccination? How do we get people involved? What are their reservations with the healthcare industry in general? And how can we as a provider kind of break down some of those barriers and get to getting them as healthy as possible?
Thank you. One of the things about having an established community center with paid staff, right? Adrian is a mover and a shaker and a hardworking activist on the eastern side of the state, and I've been a mover and shaker on the western side of the state for over 30 years in Pittsburgh. And so having those established networks, right, knowing key people we could reach out to, places like Babashi would not normally have a voice at the table, and yet having the people who are truly most vulnerable in a pandemic, who already have existing health disparities that we are aware of, having them be part of the study is crucial. There's a lot of lessons, like anytime you do any research, my favorite quote is by Albert Einstein that says, if we knew what we were doing, it wouldn't be called research. Because honestly, like any research project, after it's done, there's lessons learned, right? So there's things that we would do different. We launched it so quickly, and sent it out to university professors and, activists that are known to us. We sent it out to people in our own GWU network. We made a lot of strategic decisions, like anybody who's ever gone through GWU's IRB process can know that it can take 2 to 3 months maybe to get something back. So Pennsylvania also has a lot of hesitancy about outsiders coming in, telling us what we do. So both Dr. Moss and I teach at Bryn Mawr as well. And so we made the strategic decision that at a smaller college with an IRB process that really was a couple conversations and an email or two, that we could get the quickest turnaround, and that way it would be sponsored by a local college that would automatically reduce the hesitancy of even taking the vaccine, right? Being close to Philly, being close to Bibashi, you know what I mean? It's like making sure that you use the networks that you have. One of the things that we were talking about in terms of, as a group, publishing and connections. And I personally, I've done a lot of community-based studies in unpaid positions, much like Sabrina and Christina over the years, but not realizing even then the importance of getting my name on those, need assessment findings or anything else. I've been doing this by the seat of my pants for a long time. And I'm a first generation to go past high school. So, learning how to go through the academic hoops has been a challenge, to say the least. And yet, when we neglect having real, true community partnerships where we don't even do the basic outreach to them, our data was so enriched by including Sabrina, by including Max. We got responses from a trans support group that meets in Somerset County, Pennsylvania. By reaching out to, I did a presentation a couple years ago. We got people from like Allegheny Forest, so it's using and utilizing the networks that you personally have, as well as the established channels. One of the things that I regret is that we rushed it through so quickly. We didn't even get many of the universities and colleges. Pennsylvania is known for education. And, even in Pittsburgh, we've got like 20 colleges and universities, including places like Carnegie Mellon, right? So there are a lot of opportunities that in hindsight, I wish we had done. Is that your impression as well, Christina and Sabrina? Like, what would you have done different?
Yeah, I think because we're down the street from Temple University, that would have been a great relationship. They're also one that has a pretty good community outreach team to get people involved. But there are a lot of universities in Philadelphia. All around. You've got LaSalle, you've got St. Joe's, you've got Temple University, you've got University of Pennsylvania, you've got, you every other corner. Of course, Bryn Mawr, you guys were a part of it, but
Drexel,
Jefferson,
Drexel,
Westchester.
duh.
And that's just there. In Allentown, we've got Lehigh and Cedar Crest and Lafayette and Muhlenberg, and Kutztown's not far.
And Chatham and Carlow and University of Pittsburgh and Robert Morris and LaSalle and Seton Hill. And there's so many.
That's so definitely something I think with a little more time, we could have reached out to those groups. And through the health needs assessment, we have connections with the LGBTQ student groups at Penn State, including the extension campuses. And that could have been a great way to reach some of those more rural areas. I think given a longer timeline, we could have done a second tier of targeted promotion, reaching out to the partners or universities or developing new partnerships in the areas that we saw we had lower response rates.
Right.
But all of those things take time and or money. So given the resources we had, I think we did a pretty great job.
Yeah, I do too. I mean, I'm not dogging our work, but you know, both Tamara Moss and I myself teach at multiple places. We have a lot on our plate, and yet this was the need of the day. You know, if you would have asked me in January, are you going to be a COVID LGBT researcher? I would have said no. But nobody was looking at that data specifically in Pennsylvania. And, you know, the governor's office wanted, how do we do target? How can you go to the governor and say, we need targeted information and money if we don't have the basic preliminary data to give them? And unfortunately, data is the driver for allocation of funding. And without having key places that are funded or key people who are funded to do this kind of research, when the statewide and the national collection agencies aren't collecting SOGI data and SOGI specific responses to a global pandemic, then, you know, it's like I cut my teeth as a activist with ACT UP. And so knowing how there has to be grassroots driving public health, driving research, driving awareness, driving, you know, outreach efforts. So it's like, I see this as a one big spiral. So I'm no longer in the streets screaming, but I'm, you know, leading up, pulling together and weaving together all of these key components to do grassroots research that needs to be done right now. And it was really something I struggle with. I mean, Dr. Moss continually says, but you're the PI, but you're the PI, you're the PI. Because I still, to this day, with Christine's like, I'm a researcher, I'm a social worker. That's my core identity. And yes, I believe research is important, but I also believe that services are the most important. So I feel like I'm kind of torn betwixt what Sabrina and Christina do all the time. And that's more my natural habitat. But I was wondering if you could talk, because one of the things I've noticed is like how there's a hierarchy that even gets played out whenever we pull together a group of people. And I'm wondering if you can talk to a bit of that, because I'm trying to make sure, like, I personally don't care who's first author, second author. We've got a whole bunch of presentations in the pipeline. Who's going to cover what? You know, I think of it truly as a team, and that we're always stronger when we share the pride, when we share the glory, instead of thinking that it's one person who has to, you know, be the best and the brightest, who has to be out there with their name everywhere, when it's really the work of many people. So Sabrina and Christina, I'm wondering if you could talk a little bit about your experiences of hierarchy versus sharing, and how, you know, what kind of things you experienced.
You want me to go first?
You can go first. That's all right with me.
I mean, obviously, you know, we talk about where people just in general in society fall on this perception of hierarchy. And so a lot of the people that we had participating in the study felt like, you know, I am Black, I am trans, I am homeless, you know, I am at the bottom of who you guys are targeting in terms of wanting information, and you have nothing to give me for it. And so having having the conversations with them, I'm like, you're exactly who we need to talk to. You're exactly who we need feedback from. You're exactly who I want to pull this information from, because you're important to me. You're important to what I do. You're important to what I have to give to everyone else, because I don't know that the other organizations would have had a conversation with you. You don't have the access to this information that other people would. You don't even have a television. You know what I mean? Like, you're doing sex work, and there aren't many people who are asking you, how do you feel? You know what I mean? What they're asking you is how much. And they don't recognize you for who and what you are. And here's an opportunity to be recognized for that. To be validated in who you are, and to be comfortable with saying, this is who I am, and this is how I feel about my interaction with the medical field. That's so very important. And just that little bit of voice that they were given, and understanding that the numbers that we draw from this is piled in with a gay white male who is seen as here on the hierarchy, right? Whether we see it that way with each other or not, that's how it's like, that's how they feel, and that's the feedback that we get. And so I'm saying, no, I need you to give me information, and I need to know how to reach the other people who are a part of your family. I need to reach the other people who feel like, you know what, I want access to this. I want to be in a safe space. I want to be identified as the pronouns that I'm telling you that they are. And I want to be able to come back for other things in the future. Or I might have COVID along with something else. What we didn't talk about, the secondary and tertiary things that we find through research, having people come in and engaging them, because we sent it out, obviously it's on a digital platform, but people were coming in to finally get tested because they hadn't heard from Babashi in a while. Our HIV numbers were through the roof. We had not seen numbers like this in at least 10, 15 years. Our gonorrhea, so there's super gonorrhea. I don't know if you all know this, but as the result of the medications that people were taking to combat COVID, they developed this super gonorrhea. So we had people with gonorrhea, chlamydia, syphilis started to rise. We're like, what is happening? People weren't socially distancing. They didn't have those things that they were able to normally do in order to feel socialized, a social group of folks. And they weren't able to make money in the way that they typically made money. And they did it. The interaction that they had was sexual, and it wasn't safe. So our viral suppression those numbers went down, like all of these things were happening simultaneously. And we're saying, and we still want you to give us information about how to treat you and how to interact with you and what your fears are. And they're like, this is the fear. The fear was something like this happening again, and feeling like, oh, I can't be touched, or people don't want to be around me, or there's a barrier between us somehow. So again, going back to the hierarchy, I was asking for information from a group of people who just had never been asked before. Or if they were asked, they felt like, what are they using this for? What's the conspiracy behind the information that we're giving?
Thank you, Sabrina.
I think Sabrina's definitely right. There's a hierarchy within the respondents, and I think some of it was pretty transparent. We were asking questions of everybody. We were asking, are you vaccinated? Are you not vaccinated? If you said, yes, I'm vaccinated, you answered a much shorter set of questions. And I think that was clear from the titles of things, from the instructions, because those were not the people that needed our help and not the people that we really needed information from. They obviously would have fewer concerns. They don't need the same kind of information. And I think asking, really fine-pointed questions, what do you need to know? Who have you called about the vaccine? Gave us the information that we hadn't had. What's stopping people from getting vaccinated? Because it wasn't just hesitancy. It was concerns about transportation. It was concerns about taking off work. It was not being sure where to call. And that directly informed the messaging that we were putting out immediately after. So I couldn't give you what that looks like overall, but definitely within our local community, there was the response. Oh, wait, we answered those questions. This is what that turned into, which was great to really be able to turn that into actionable messaging right away. But to address the other portion of what Kat was saying about hierarchy within research, as someone who's worked for a major university as a low-level researcher, this was a very different experience. I'd say that my previous experiences working on a project like this, the hierarchy was really clearly defined. The PI is the boss. And then there's, faculty researchers, and then there's analysts, and then there's the assistants. And then there's any, hired subcontractors for that specific project. Whereas this, especially with a 4-person team, I think we all really could clearly see everyone else's expertise, and each person was given the opportunity to really fulfill that role and really shine with what they knew. Because yes, I consider myself a researcher, but I can promise you that Adrian does not feel the same way. And on paper in the hierarchy of things, he is our executive director. He is absolutely my boss. But within this project, I never felt like my expertise was questioned, but that all of our team members we really understood where each person could make great contributions. And one of the great things about being able to have so much output from this one body of work is that depending on the audience or depending on the goal we're trying to fulfill, maybe Tam's the best author for that. This piece is going out directly to the community. So maybe Adrian should be the point person on this. This is very much a data specific project. Maybe that's something that I handle. And then being able to put those things together in a really collaborative way, whether it's me drafting and getting those really detailed edits that I think only someone with the experience like Kat could handle, and fine tuning those projects so that we know that we're putting out the best product possible, I think is one of the best research environments I've been in. So I really thank the team for that. But it's when you do a community-based project, you can avoid some of those pieces of more rigid research structures that don't always lead to the best collaborative environment. And I think that's what truly worked for this project. It won't work for everything, but it did really work for this.
And I think the other piece of it, thank you for that, is that, Adrian is very good at getting positive press, not only for Bradbury Sullivan, but for our book, for, his efforts. But one of the things that I noticed right away was I think of community partners like Sabrina and Tiffany as just as crucial voices, and Max and everybody else who, helped to distribute the survey. And yet I know there were some feelings that were hurt because Babashi and Sabrina, especially jumping in and saying, yeah, I'll do it, no problem, without money for a nonprofit. The least we could do is give kudos and thanks and publishing names and, highlighting some of the important work that's being done there. That's the least we can do, right? The best we could do is actually allow for first authorship or publication experiences, or paying not only Sabrina or it's Christina specifically for their work on the project, but also honoring their time. And, I have no money for this project. I have no money for the California project. I've had my phone ringing off the hook about, hey, can you do South Carolina? How about Florida? We're down here in Georgia. I'd like to do this up in Connecticut. How about Indiana? How about the UK? Well, I've talked with Kate about doing one in the UK. Tamara would like to do one in the Bahamas. Notaling would like to do one in South Africa. So when you have a good model, you can pick it up and move it if you have a team that actually is committed to that, right? But the problem is that I bump up against, and I know Sabrina and Christina do as well, is the bandwidth and time, right? So I would love to pour my energy into this. I think our community needs this. It's crucial right now. We need to know that data. Unfortunately, we have not had the luxury of having a paid funder for this kind of research. So Christina, how many presentation proposals have we had accepted, let alone submitted?
Accepted, I think we have
3 or 4?
4.
We're already in the pipeline?
Yeah, and we put out 1 or 2 more than that weren't accepted, which I actually think sometimes directly relates to that question of who do you put as the first author. Sometimes, like I had to wonder, did we not get accepted at APHA? Because for that one, we listed me as the first author.
Right.
Impossible to know, but it is something
Right.
You have to wonder. But overwhelmingly, I think it's getting traction. I think sometimes oh, thank you, Kate. Good to know. That gives me hopes for next year.
They don't disclose authors. They have you grade based off of abstract. So I don't know if you can be able to find the reviewer who reviewed it to get feedback for next year.
I might, especially because we are considering submitting
Public
this
health
work
measures.
elsewhere. Yeah. But
And
it did get accepted several places, which is very exciting.
Lemma, SASH, SSSS.
Yeah, Quad S,
Quad S.
SASH, Glamma, and it was also accepted for a COVID-specific webinar by the Pennsylvania Public Health Association. So we didn't get APHA, but we got PPHA, and I'm excited about that one. It's going to be a very busy fall.
But
Yeah.
I wanted to circle back to what Kat said, because in all of these great things that are happening, what our fear was exactly what happened. Babashi was not mentioned.
Yeah.
It was not mentioned in the research. And it was a slap in the face to the people who took the time to push out to our community and ask them to participate. It felt like here we are again giving and not being acknowledged.
Mhm.
So obviously, I'm not a researcher. I'm just trying to help you guys get, data. But the people who participate feel like, our name is not being acknowledged. And it feels for people who come from an experience like mine, like a continuation of the rape that has happened. It's like we can give, but we're not a part of the successes. It's not, where do we appear in the line of names of contributors? It really has to do with, are we there? And when you go up and you're searching for your name and you're not there, and you're like, if we have 5 people who contributed, that was 5 people that, had a voice, who wanted to be heard, and they weren't acknowledged. So, it was a sting because I'm the representative who asked them to participate. And so I called Kat and I was like, Kat, I'm gonna be honest with you. I'm typically the only Black in the classroom, and I find myself being that voice. And, I was the only Black and brown, explicitly Black and brown organization in this research, and we are not named.
Right.
So we have to be careful of those things because we take so much for granted. And, I, in my mind, want to think, it was just, they just forgot. But there's a sting that comes with that. And we can't not have that conversation, that we have to acknowledge if it's 2 people that they were a part of this research and that their voice was important and they need to be listed as such. And not for nothing, it would help you, you know,
right.
in terms of the people that we're a historic institution in the city of Philadelphia. We're definitely a historic institution in the United States of America, being the first African American organization to provide this service. To have it as a part of your research, you would think would be a badge of honor, but we were omitted.
And
I
that's one
unfortunately
of the
think that
downsides.
happened to quite a few of the data collection partners,
Yeah.
that what ended up in the report was only the very small group that was approached before the project began, rather than the much larger network that actually got involved.
Right.
And one of the ways I see as one, that's a key point in what needs to be improved in a project like this, is how do you think everyone, and how do you think the partners that not everyone on the team is familiar with? So I felt like as someone who's sort of new to this area of research, who'd only been at the center a very short time, a lot of the times when we work on projects, I get CC'd into these email chains, or sometimes not left out at all, as the sort of the technical aspect of the work, where I don't get to meet and engage with our partners in a way that really allows me to know them. But one of the great things that we were able to do with the health needs assessment, and admittedly we're able to do it because of the funding behind it, is one, pay the partners. If I could do this again, we'd pay everyone because there was so much really essential work done. So not only would we put paid promotion behind it, but pay them for their time. I wish we could have given the actual respondents incentives, even small ones, but it wasn't something we had time to develop or factor in. But even if we could have done a non-paid incentive, like personal thank yous, I think there's things that we could have considered that, didn't make it in.
Yeah,
But
I think, we don't need the money. I mean, thankfully, we're in a very good financial space. I don't know, COVID was a blessing to our organization, but that statement, say her name, say his name, how we felt, say our name, say our name.
That was part of what I'm really grateful that Sabrina reached out, and she's like, look, when the first report went to the governor's office, Babashi wasn't even mentioned, let alone the network that I tapped into. And I completely understand that, right? So like for the first two press releases, and that's the downside of not having a hierarchy where I'm the boss, everything comes through me. Adrian was very excited and wanting to get this information, and the governor's office was needing the information, but we need to do a better job at actually honoring and thanking the people. So like the next couple times that, press releases came through, or I got called about, hey, can you tell us about your study? I made sure that they highlighted Sabrina specifically, and Max, and the people who weren't listed, as key folks, to make sure that we get this information. And it was one of the lessons learned that went into informing the California study. And so, one of the things that I learned is that in terms of rushing it through, we made some major mistakes, right? And that I was assuming other people who were willing to be on the team and throw this together this quickly and move forward had the same notion about shared responsibility and shared honoring of each other. And that's not always the case. And so in California, we've actually got much less numbers in the same amount of time. In part, I think, because our partnership there is through California State University of Sacramento and the Sacramento LGBT Community Center, which David will be coming on in a minute, who is the head. He just much like Adrian has a paid staff. They have established press networks. We worked really hard to make sure that we had a Spanish survey that was done, and I had it double checked and triple checked by many, many different people. But we've only had less than 500 respondents in a much longer time frame and 0 Spanish respondents. So I'm saying we as a team need to go back to the drawing board. And I reached out to people like Tiffany to say, hey, will you help us, in your local area, distributing the information? What we need to learn more in terms of not just the vaccine hesitancy, but the second phase should be the impact of the quarantine, the impact of the shutdown. How did it personally impact you, whether it be finances? Some people got more money because of, funds being open. Other people, were in food lines and couldn't pay their mortgages for months. And then the third phase that I'm most interested in is the resiliency issues. What kind of things allow people to survive pandemics? As queers, we are the experts on how to survive a pandemic. We did the first one. It's like we have lessons that we can already utilize first for this. And so, Tiffany, I'd like, since David's not on and haven't got a message from him, I'd like your discussion in terms of what you think of for the California study, some of the reasons why we're not getting respondents, hearing about it in other places, much like, in Pennsylvania, there were lots of avenues where I heard about it in the wild, but in California, I'm not hearing anything.
Certainly, yes. Thanks, Kat. And I feel like my experience has been so different because I'm in private practice and I work at a smaller facility in Orange County, which unfortunately does not serve many folks in our community. And so I had to really plug into my other networks that I've connected through either friendships or through my work at the Veterans Affairs Hospital. So I did my internship and my postdoc at the Long Beach VA Hospital. And so I had some good contacts there, some other community partners through other work through HIV research, but I had really been out of the research field for a while because I've been focusing on clinical work and on my training. And so when Kat reached out to me, I was super excited because I'd really missed doing research. And I was excited to get back into this work and, also help with COVID. And I mean, the personal is political. Many people I knew in my own communities had been impacted. I knew people who had lost their lives to COVID. And so I wanted to find a way to give back and be involved. And as the personal is political, I actually got an email yesterday saying I was potentially exposed to COVID. So I am now quarantining in my house. And so I have been working in person since October. At our facility, we have been treating folks in person because it's just too difficult to coordinate. It's a residential program, and so our clients really want to be seen in person. So obviously, I cannot go to work if I have been potentially exposed. I am vaccinated and I'm feeling pretty good. So fingers crossed, I'm okay. But until I get my results, I will be at home. But it's just things like that, seeing the impact financially and just emotionally, mentally, that the virus and just this pandemic has had on all of us, and especially our community. And so for me, it was really important to reach out to people that I had strong contacts with, but to what each of you have already spoken about is people are overworked and taxed, and it is challenging to get responses. And so I think a big factor is in California. Honestly, I think we've had a pretty positive uptake of the vaccine. There are definitely a lot of people who are not vaccinated, a lot of people who cannot get vaccinated, people who, are also just not willing for all the reasons that we've already spoken about. And Sabrina has really touched on that, especially in Black and Brown communities. There's not a lot of trust around a vaccine that is being distributed by the government with reason. And so, and I can even be honest in my own hesitancy to take the vaccine, but being a healthcare provider, and thankfully I have lots of friends in the medical field and they educated me well and I got good information. And so I felt more confident going in to get the vaccine, but I felt very anxious about my 87-year-old grandfather getting it, but also knowing that without it, his life was more at risk. And so for me, I just felt like getting out the information, people having avenues and knowing who they could contact if they wanted more information about the vaccine was really important. And I am sad to see that we haven't had as many responses. And I'll definitely be plugging back into my networks, checking back in to see what's going on, have people had an opportunity to distribute it. And yeah, I think that there will definitely be more information coming from David. He's been more involved in the project and for longer, but I'm definitely honored to be a part of this and excited to see where it goes. I think that we will hopefully get more responses, as sadly COVID is back on our radar in a bigger way as we roll into the fall.
Yeah, and just right on time, David's popping up. So let's give him a moment to come on to screen. Thank you, David, for coming on so early on your time. You're muted.
Morning.
Morning. We just covered some of the issues and lessons learned from the Pennsylvania study, and I wanted to get your perspective in terms of the community university partnership and the numbers that we have that are disappointingly low in California, and sort of the going back to the drawing board and figuring out a new way of distributing surveys and maybe having more focused attention on getting that information out.
Sure. I mean, when we started this project, vaccines were not readily available to community members at large. They were really only available to healthcare professionals, and older folks was sort of starting to be the case. So at that time, there was a lot more urgency and sort of the demand for vaccines in any way that you could possibly get them. So, but by the time that we launched the survey, it was vaccines were widely available. The supply was widely available. Pretty much anyone could get an on-demand appointment for a vaccine, which has like benefits to it in when you're asking people, you're asking them in an environment where if they want one, they can get one. However, you're also more people had the vaccine already, and there were a lot of efforts underway to do outreach to get people to get the vaccine. So just to give some context about sort of when we started this, like in an idea phase, to when we actually were able to launch it, the sort of environment was very different. And so at this point, we have reviewed the numbers of those surveys that we received. I think that given the lack of urgency by the time that we did launch the survey, made partners less apt to put a lot of effort into getting the survey out. It certainly made it less interesting or urgent for people in the community to participate in the survey. There was no incentive offered for completing the survey either. I think that we thought that at the time that that getting the access to the vaccine was incentive enough for people to share information about why they were or were not getting the vaccine. But we had intended on working with partners throughout the state. There are more than 30 LGBT centers and advocacy organizations across the state of California, many of which have very extensive communications networks. And so we were intending to use that existing network sort of on their own goodwill, since we didn't have any financial resources to back this project, to get that information out and then be able to turn back around the results of the survey and understanding of why people were not getting vaccinated, to be able to do outreach in their communities. And again, I think like the timing of when we were able to launch the survey had a very large impact on the survey success. So at this point, like the number of people who have not been vaccinated that have responded to the survey is very low. Sort of shockingly low. I think over 90% of the people who have taken the survey have been vaccinated, which is massively disproportionate to the population at large, right? So, and not the direction that we were expecting, would have expected probably early on. So anyway, so working with the university partners on both on the East Coast and the West Coast is challenging. People have things going on in their lives. We had to clear two sets of requirements and went round and round, sort of changing the survey even as time passed and we learned more about the pandemic. So you're trying to do research on a current event that changes every single day. And that is inherently challenging. So.
And I think too, in terms of launching it in July, right? I don't remember our exact date, but it was right around the end of June, early July. And that's prime vacation time. We have had a lot of white respondents, which is not really reflective of all of California demographics. Making sure that we, use all of our CenturyLink contacts, making sure we network into the colleges and universities, tapping into the grassroots advocates, the people like Dr. Lori Lapina, who's actually on the boots on the ground down in San Diego, Dr. Tiffany Grimes, who's in Orange County, making sure we have key people in areas throughout California who can help distribute the information. And then being willing to go back and go, okay, this isn't working. What are we doing wrong? Right? I think that's an awful lot of the times when you're doing research, the only thing that gets published are the positive results, right? So everybody looks brilliant, like they never ever made a misstep. And yet I think we learn just as much, if not more, from how are we screwing this up? How are we not reaching the people who are most vulnerable? And, we have one center that said, yes, we're going to do this, and, is doing the best they can in terms of the resources that they have, right? Because it's not a paid thing. Any work gets taken out of the work they already are doing. And yet having to respond to something that's changing all the time, right? Having to respond to different governors, having to respond to different community needs, and being open to that. What I'd like to do at this point is open it up in case anybody has any suggestions or questions, or, clues in terms of how we can make this better. It would be lovely. I think we would all be open to that, because we really have had to do an extension for the IRB for the California study. And I'd like to do, like Christina mentioned, from what we learned now, what other things could we move on in terms of learning past just the hesitancy, but tapping into resiliency efforts as well in Pennsylvania.
I have a kind of a related question, or I will relate the question. I'm wondering what the pandemic did to the nonprofit organizations where you're collecting the data, and if that maybe affected some things in California.
Yeah, and we don't know. I mean, I know a lot of, I tried to get people from Sage in New York, and all I kept getting was the answering machine.
Yeah.
So we know a lot of grassroots organizations are really struggling. Here locally, the GLCC, which is now the Pittsburgh Equality Center, closed up shop, literally. They put
Right.
everything into storage unit because with that pandemic continuing for a year plus, they didn't have the fundraising, they didn't have the community access, they couldn't allow people to gather in large groups. So I think that's a key piece.
Yeah, our community center completely closed. We laid off all of our staff in the end of June, and it was just the board members who were kind of running the place, and all of our programming went away. It continues to be a big mess.
Louis, do you mind if I ask where you are from? My apologies for I wasn't able to join earlier, but
Oh, no, I'm from Rochester, New York.
oh, okay.
So it's the Out Alliance. We had
Sure. I've been to the center there for the CenturyLink conference a couple of years ago.
yeah.
So I mean, out here in California, this is one of the other things that early on sort of we understood in terms of comparing what was what the survey results might say in California versus what they might say in another state. Is that the experience of California life during the pandemic is probably very different than much of the rest of the country, right? San Francisco shut down first, and California shut down first, and our restrictions have been very strict relative to the rest of the country, and continued all the way up until June 15th. However, that date also had a lot of uncertainties associated with it. We found out in mid-April or end of April that June 15th was going to be the magic date, but absolutely no details about what that meant came out until May 27th. So we didn't, or May 24th. So we didn't actually have that much time before June. And this is that is exactly the point when we were launching the survey, was there at the 1st of June. So the first details about what that was going to look like came out then, and sort of the doors then on June 15th kind of magically just swung wide open, and it became the wild, wild west after 15 months of time essentially on lockdown and not being able to go indoors for anything. And so there was a sort of really fast cultural shift in what life was like on the ground for people. Centers had to adapt and figure that out quickly as well. Most of the centers that as far as I'm aware of out here, have weathered the pandemic and have been able to remain open if they had physical space. At least the larger ones. We all took significant financial hits, and some centers did have to make difficult decisions about laying folks off and reducing their workforces and closing their doors to groups. We at the center here did close to groups, but since last year we've been open by appointment. So if individuals could come in for services by appointment, and then most of our things have been virtual and online as much as possible. And I think that's pretty true across California generally. But it does mean that your operation changes. You don't see people in the hallway. You don't have as much opportunity for natural collaboration with your colleagues. And if there are staff members who have been laid off or dispatched or otherwise committed to different work than maybe they had been assigned at the beginning of the pandemic, this might be a lower priority for you to participate and to be able to really extensively do outreach if you're trying to if everything you're doing is digital and you're trying really hard to be in communication with community members to ensure that they have access to their basic needs services ahead of everything else.
It's a great point.
Yeah, I agree with what David mentioned. Also, I feel like so many community members are used to just coming into the clinics and coming into the centers. So trying to do this work virtually is definitely a lot more challenging. And I'm just noticing a lot of my colleagues are working from home, and so they really aren't having that same contact with the community. And especially clinicians, it's like you're doing this, you're booked back to back virtually all day. And then to send one more email or check back in about that one other project is challenging at the end of the day.
I'll also just say that for staff working in these centers across the country, whether they've been working from home or whether they're coming into the center, and that transition was also happening exactly at the same time. So staff were being asked to come back into the office, they were becoming vaccinated, they were having the opportunity to come back in. But this whole year has been really disruptive and traumatic, and the re-entry into in-person contact with your colleagues and with community members and patients is hard. And I'm sure you're seeing lots of stuff in the news about how that process is challenging for employers and for employees that are sort of reintegrating into what the life was like sort of before, but it's not the same now. And that's really hard. People are making decisions about what's a priority for them as well, that maybe wasn't less of a consideration prior to the pandemic. So the sort of internal operations of centers, regardless of how much planning and how resilient they have been and are, we're an employer like everyone else. People that work here are people like everyone else. So all of that sort of trauma and built up anxiety and stuff from the pandemic also impacts us as individuals. And so I've been here every day at the center pretty much throughout the entire pandemic, along with our senior leadership team and some key operational folks. But there were several staff members who had not been here ever at the center that we hired during the pandemic or were here before the pandemic for a brief period of time, and their first experience coming into the center was only about a month ago. So it is a challenging time, and now we're sort of reversing course where the state and the governments around the country are starting to issue mask mandates, require vaccinations for everyone, which is another thing that we have to sort of work through, and it just causes additional anxiety. It's constantly changing every day. I don't know, like 3 times yesterday, there were different messages being sent out. So
And I think that's the other piece, right? So you got to have a core team who understands some of the logistic pieces, right? So there's myself, Dr. Moss, David, Sarah McClellan, who's the associate chair for the Department of Public Policy and Administration at Sacramento, at California University of Sacramento. Michael Mink, who was a professor of public health, he's the department chair. He knew really well the IRB process there. And so having those key people as the core group, when I reached out to them, David and I had never met. It was because of a friend of a friend of a friend kind of connections. And that's what happens a lot in these kind of impromptu boots on the ground research studies. We went from not knowing each other to having 3 or 4 meetings within 2 weeks. And so that's what happens. Other questions?
In terms of the paid promo for the surveys, like what does that kind of mean in terms of like what networks you're going through? Is it like social media? Like where have you been doing the paid promos for the surveys?
it is on social media, and it's dollars that we are able to access from unrestricted dollars in the center's budget. Like I said, we didn't have money at the beginning of this project. In fact, one of the goals in I've been doing this project was to identify whether or not there was hesitancy within the community and what level that would be and what messages might resonate with folks to change their mind and convince them to be vaccinated. So and in doing that, sort of if we could present that there is hesitancy, and these are some of the strategies that might work to get people to get the vaccine, then we might be able to pursue funding to help support that work and to do the marketing and outreach to get more people vaccinated. And that was sort of one of the goals at the outset. But again, the timeline over which it took us for us to implement the survey and to get some valid results has been longer than would have been helpful, I guess, to access those funding, because things changed so quickly during the pandemic, and funding is just being pushed out there. Fortunately, we have secured some funding to do outreach around vaccines, but it wasn't in time nor as a direct result necessarily of doing the study, because we haven't presented any results. Yeah, funding was a key component that we just decided internally that we would spend some resources on advertising on social media to push the survey out.
And Bradbury Sullivan did much the same, right? So I understand, because I was co-chair of a community center for so many years, I understand that urgency, right? And so David and Adrian were often going, when can we get this going? Come on, when can we get this going? And yet I also understand from the flip side of trying to make a quality product and taking the time necessary to go through the IRB and get everything approved before we could launch it, right? And so there was always that push-pull. I utilize Facebook a lot. Twitter is what Tamara Moss uses a lot. We use our own personal emails and networking with emails and connections to, hey, are you interested in helping us? Can you, pass this around your network? And just giving some of the immediate press releases that got done as basic information. All that had to be created beforehand as part of our IRB packet. So, each different organization through Centerlink, or each individual organization, whether it be a private practice or a community group, could then take our approved statements and put their own logos on it, so that way, as someone who understands how to do outreach in terms of the gay community, that you need to be able to have a logo that they recognize. Hi, we're doing research for Bryn Mawr University isn't going to do it, right? It's not the reason that people would be invested, especially if they're not getting paid for their time, especially if we're asking them questions about something they would rather not think about right now. Or that they're getting saturated with.
One question I had was whether or
Sorry.
not you considered like the model of research that you're using for this CVPR, like community-based participatory research, or if you have like your own like understanding of what it is.
I think go ahead.
Oh, I would say I'll take that if no one minds. Yes and no. I think for it to truly be CVPR, we would have field tested the survey instrument. We would have maybe conducted key informant interviews, either here at our location or with some of our other partners to really inform the survey questions from what the community felt like they needed to know. On the other hand, we are part of the community. And so when we were, writing these questions and looking at the results, was I viewing it both as a community member and as a researcher? Oh, absolutely. And there were things that I wanted to know as a concerned Pennsylvanian that made it into the survey. But at the same time, I think for it to really truly fit that definition, it would have had to have been more than just us. The place where I do think it succeeds, and that we do this to an even larger extent in the health needs assessment, is that we got the information back out and into the hands of the community. And that it doesn't just, sit on some university server somewhere, but that it was for the community and that it's informing the services that the community is providing, including vaccine clinics and messaging coming from not just our center, but other centers. So in that respect, I think it succeeds, but I think there's other ways in which that could be improved. So it's definitely not strictly community-based participatory research, but there are elements of that model that made it in here.
Perfect. Thank you very much for taking that one. One of the things that I really see as our next steps for the California study is revising the IRB, requesting a change, and then going back and really talking to our core group about, okay, was it the timing, who did you actually put it out to? Because, for a while in Pennsylvania, it was just keeping a list of who you emailed, because we have to have that information for any of our publications. So, who did you reach out to? What groups were involved? Did we really effectively tap into Centerlink? Have we effectively reached out to any of the college or universities GSAs? Have we done any specific outreach to Spanish-speaking communities? Making sure maybe we need to get some key informants and key stakeholders from those communities in the mix so that we can actually truly represent all of the demographics. Do we have any folks in the Asian community who are coming into the mix? Because, California really is a very diverse state. And when you start seeing respondents who are primarily skewed white and middle class, then for me as a researcher, I need to go back and look at who are we missing and how are we missing them? Yeah, exactly. In journal articles and publication and conferences, yeah, I definitely took Sabrina's immediate response to, wait a minute, how come Babashi's not listed in the governor's report to heart? And that wasn't my intention. I actually did not see the report until it got published. And I think that's one of those things about not being the boss, that we were all trying to do the best we could. And Adrian had a team that could do the marketing, could do the press reports. Christina is amazing in terms of data. So, as a community person, you don't have to wait and ask for permission. You just do it, right? Especially if you're the executive director of that organization. But as somebody who really does believe that community partnerships provide the best data and the best resources, that we can't just see them as sort of as our unpaid and, you know, tapping out and getting the best of the information without actually giving them some of the praise and kudos as well.
Yeah, for sure. I just think of myself, like if I was in graduate school in Pennsylvania, like as a person with immense privilege in the LGBTQ community, being a cisgender white man, like I would probably not know about that organization. If I read about it in a APA journal or something like that, I'd go, hey, this is a way I can make my data more representative of the LGBT community.
Exactly.
Yeah.
Any other thoughts in terms of how we can approach it differently, or suggestions on how to be more responsive to the community?
I think what I hearing from Sabrina was really valuable. I think like I really appreciate people who are just going to be like straight up like, no, I really didn't like that. Y'all shouldn't have done that. And I'm like I have so much respect for that, and I really value her doing that in this setting too. And I just think we need to make sure that we do that when we feel like we've been slighted, when we feel empowered to do so, and also making sure we can do that for others. Yeah, and I think it's important that, like y'all are, to own that rather than being like, oh my gosh, like we didn't mean to, we're so sorry, like, you know, like, and just like groveling about it. It's like, nope, there was probably
We screwed
like
up.
like it happened and we messed up, and at the same time, like it's not as simple as we messed up. Like there's layers to how this occurred, you know, and like owning that. And I think as long as we do that, we're going to be more willing to improve.
And I think that's where the personal connections come in. That's where the networking really comes in. You know, I own that I screwed up. You know, I didn't have a control on it. I didn't have everything that gets published has to come through me. And I still think that's actually a good model, because I think what I need to do more is to get complete buy-in from our people who are part of the core team, that they truly understand that it's about sharing the information as well as sharing the kudos, you know, and the respect that the people that are the folks that are doing the work are often the ones that are the least paid, the least privileged, and, you know, have the best contacts for the community that we're really trying to reach. Other thoughts?
I'm just going to say, like, from a structural standpoint, when I compare the way we engaged data collection partners with the health needs assessment, where that literally for 2022 is starting very soon, that's
Right.
in the lead up to the survey, where everyone gets to sign on and understands their role, what's expected of them, and how they will be attributed. When you've got the time to build in those things, it works really differently. But then also being able to get the feedback, whereas we didn't build in a feedback mechanism for this. And so I'm sure there's other concerns that haven't even been raised yet because we haven't gotten to that point. And I think as time goes on, we'll need to catalog those and really say, okay, what can we make sure doesn't happen again? Especially to be able to continue good relationships with those really important partners. And the thing that I hope that we'll at some point get to with this project, but as Kat and Sabrina both talked about, that this isn't something that's funded. My time on, you know, any of our time on this is not sort of paid time. In some ways, it's very much a passion project, but to be able to put out that localized data, to be able to put out, say, a Philadelphia specific report that organizations like Babashi or like William Way was one of our other Philadelphia organizations are able to share or, even making it more specific. For example, William Way primarily serves youth. And bringing in those intersecting factors so that they can once again put it back in the hands of the community. I think that always needs to be the ultimate goal. But already the information that we've collected has changed so much. Some of the things we asked are not relevant in the same way as they were just a few months ago. Definitely, this was my first dip into such a quickly changing situation, and I think the lessons that we learned will really impact the way if we were to conduct other research like this in the future for COVID-19 or for any other issue. Understanding how fast things change.
Right.
I think it's something we've all had to learn during this pandemic.
Well, I really thank Christina, Tiffany, David, Sabrina for sharing their knowledge and their wisdom for this session. And I think it's crucial that we fill out the survey responses for our sessions, because that's what I just put it into the chat, Steve. We're going to take our break and then we're going to come back. It's the intersection of queer art, creativity, and health is the next session. That's going to start at 11:45. So thank you, David, for getting up so early. Thank you, Tiffany, for getting up so early and being willing to be on from California time. David, we will definitely be in touch. I'm taking 4 days off from the world, and then I will come back on and in August go back to the drawing board. Thank you all.
Yeah, and I'm going to shut down the session. We're going to once again try to get this chat thing licked. Seems to do this every morning, but I'll close this session down and we'll see you in about 15 minutes. So appreciate it.
Thank you, everyone.
Bye.
Okay, so stop.